Well, thanks for staying with us as we get closer and closer to the start of the school year. A lot of young athletes will need to get a physical before fall. Dr. Clete Younger with St. Luke's Family Practice is here today to talk more about physicals. Thanks for coming in today.
Thank you.
So why is an annual physical for student athletes and students in general a good idea?
We like to see most patients every year. One of the most important things is we like to make sure medications are updated and medical problems are addressed. For an example, things like asthma require frequent monitoring, and we want to make sure that athletes are up to date on the correct medications, make sure they have prescriptions refilled, make sure that they have notes for school if they need that to participate in sports, and just to review their overall medical conditions.
And also reviewing how they've grown and what's changed over the last year.
Yeah, so growth and development are really important. That's how we identify some things as being normal or abnormal sometimes. So it used to be just height and weight were big things that we watched. So particularly with younger kids, weight has now become more of an issue because obesity is such an issue. Because that's something that if we treat young or start the discussion young, that we can really make big interventions prior to kids growing into adults. But other things like developmental, so emotional development, school performance, we touch on all these different things at school physicals so that we can make sure that we're doing everything on the medical side to make sure that students and athletes are prepared.
What kind of information do parents need to have with them when they bring their student in for their physical?
We like to have any forms that they need completed, particularly if they have forms for, I can take this medication during these times during the day. Do I need any sport-specific forms? In general, we have a general physical form that we use, but certain sports will require different pieces of information to be on that. And a lot of times, adolescents, particularly as they grow older, they'll have different doctors throughout their lifetime. Having an updated vaccination record or a list of medications is very important to bring in, because sometimes it can take, turnaround time of several days to weeks to get that information. And if we have that beforehand, it's nice. And as a patient, you own your medical record. You can always get copies of your medical record and bring them with you to the appointment, and then you don't have to rely on the electronic transfer sometimes. But just so we have that all at the table when we see them.
And of course, student athletes, this is a requirement for a lot of them to participate in fall sports or sports throughout the year. What's different about then a sports physical versus a regular physical?
So this is my favorite part. So I'm also a coach beside as a physician. So I love getting to talk to athletes about, what are their goals for sport? What sports are you participating in? What do you have planned for the future? Because we can talk about, are their goals realistic for their current physical ability? Are there barriers to how they're performing in sports? Is it an emotional issue or a stress issue? Are there injuries in the past that have plagued them? So joint aches and pains. A big one now is concussions as well, and what that means for them going forward. Another thing I really like to touch on is sports nutrition. So there's a lot of different things you can do to keep your body healthy besides sleep and adequate nutrition. But a lot of athletes, when they're trying to get an edge, will use supplements as well. So one of the things I like to do is make sure that they're making healthy choices. Because we want athletes to be healthy, and we want them to perform well in high school. But we also have to prepare them to be an adult. And we want them to develop a lifestyle choice that's not only healthy now, but something they can carry forward into the future and to be healthy athletes into the future.
Yeah, all things to think about. Dr. Younger, thanks so much for coming in today. We appreciate it.
Thank you.